What are the gene therapy prospects for cystic fibrosis? Gene therapy for cystic fibrosis is an exciting area of research focused on tackling the underlying cause of the disease. Cystic fibrosis is caused by mutations in the cystic fibrosis transmembrane conductance regulator gene, which affects the protein responsible for regulating chloride transport in cells. Current treatments, like cystic fibrosis transmembrane conductance regulator modulators, can help improve protein function, but they only work for certain mutations. This means that about 10 to 15% of people with cystic fibrosis do not benefit from these existing treatments. Gene therapy aims to deliver a healthy version of the cystic fibrosis transmembrane conductance regulator gene directly to airway cells. This could restore normal protein production and function, potentially offering a more universal and long-lasting treatment option. Recent advancements have led to the development of an inhaled gene therapy using a lentiviral vector. This method is designed to introduce a full-length, functional cystic fibrosis transmembrane conductance regulator gene into the epithelial cells lining the lungs. The first-in-human clinical trial for this therapy is called LENTICLAIR 1. This trial is currently assessing the safety, tolerability, and effectiveness of this inhaled gene therapy, specifically for patients who cannot use or do not respond to existing cystic fibrosis transmembrane conductance regulator modulators. The lentiviral vector is engineered to effectively enter airway cells and has shown promising results in preclinical studies, expressing the cystic fibrosis transmembrane conductance regulator in 9 to 15% of respiratory epithelial cells. This level is considered sufficient to provide clinical benefits. Importantly, this therapy may allow for reducing, which could lead to sustained treatment effects over time. The LENTICLAIR 1 trial is sponsored by Boehringer Ingelheim in partnership with the UK Respiratory Gene Therapy Consortium. It is a multi-phase study involving adult participants from various European countries. The first phase focuses on safety and dose selection, while the second phase evaluates clinical effectiveness and lung function outcomes. The trial is expected to conclude around early 2027, with long-term follow-up planned to monitor safety and durability. Gene therapy for cystic fibrosis represents a significant advancement in treatment options. It has the potential to address all mutation types, including those not covered by current therapies, and could modify disease progression by restoring cystic fibrosis transmembrane conductance regulator function at the cellular level. However, it is still experimental, and no gene therapies for cystic fibrosis have received approval yet. Challenges remain, including ensuring effective gene delivery, achieving long-term expression without adverse immune reactions, and demonstrating clear clinical benefits in trials. In summary, gene therapy for cystic fibrosis is at a crucial stage, with promising early clinical trials exploring inhaled lentiviral vectors to deliver functional cystic fibrosis transmembrane conductance regulator genes to lung cells. This approach offers hope for a broader and more durable treatment option, especially for patients who cannot benefit from existing cystic fibrosis transmembrane conductance regulator modulators. Ongoing research and clinical testing over the next several years will be vital to determine its safety, effectiveness, and role in cystic fibrosis care. Meanwhile, it is essential for patients to continue following current standard of care treatments and consult healthcare professionals for personalized medical advice.